How much do you know about the communities where you provide immunization services? What are their attitudes towards immunization? What feedback could they give to improve your services? Are there unreached segments of these communities? The answers to these and similar questions will help you to tailor your immunization services to reach more children. To learn about the communities you serve, identify people to talk to, select the most effective methods to gather information, and ask questions that help you understand your community. Let us look at each step more closely. Consider the different groups in the community who can provide information to improve the reach and quality of your immunization services. Include people from a variety of areas to make sure you're learning about the whole community. Include groups that have persistently low coverage or high dropout rates, including people in remote communities or in dense urban areas. Also include populations that are traditionally difficult to reach, such as nomads, migrant families, homeless families, street children, and urban slum dwellers. Finally, consider groups who are more likely to avoid some or all vaccinations. These populations might include highly educated people, religious or traditional sects, ethnic minorities, and persons without official documentation. Next, select the most appropriate methods to gather feedback from these groups. Using different methods will give you different data to form a more complete picture of your community. Start with existing studies and social data to learn about the local context. Use household questionnaires to evaluate the immunization status of children and better understand reasons why children are not fully immunized. Hold community discussions to gather information on perceptions, problems, and ideas for improving services. Consider holding separate discussions with men and women if mixed groups limit participation. You may also want to hold separate meetings with caregivers whose children are fully immunized and those whose children are under or unimmunized to understand the factors affecting each group. In general, try to speak with people directly. To really understand the perceptions and experiences of immunization, talk to caregivers rather than community leaders. Observe vaccination sessions and interactions between health workers and caregivers. Perform short exit interviews to hear from caregivers about their experience and their understanding of key information like the date of their next appointment. Give people a chance to share answers anonymously or on their own time with feedback boxes, websites, or mobile phone numbers. Consider the most useful questions to ask to learn about people's perceptions, experiences, and understanding of immunization. For example, you might ask questions to find out what people know and think about immunization, such as, what is the purpose of immunization? Who should be immunized? When should immunization be done? You might also ask, do you have any beliefs or concerns about immunization? If you reject immunization, what are the reasons? Where or to whom do you look for guidance on your decision? Other questions can help you learn how to improve immunization services. For example, do you think health workers explain immunization services and answer your questions well? Do you think immunization services are easy to get to and to use? Why or why not? Have you ever taken your child for immunization but then had to go home without all the vaccination doses being given? What was the reason for vaccinations not being given? Did you take your child back for vaccinations after this happened? Another critical question to ask is, where do unimmunized children or groups live? Once you have gathered information, Be sure that you analyze what you learn and take action to address problems. Now you know some ways to learn about your community. Identify people that represent every part of your community, select effective methods for gathering information, and ask the right questions.